Here in Paris, we're joined by an expert who has been appointed co-director of a national group that studies terror and its effects, especially on children. Dr. Howard Osofsky with the LSU Health New Orleans School of Medicine is here with us. Thanks for your time.
It's a pleasure to be here.
First, tell us what your appointment means, especially in light of what's happened recently.
Surely. The National Child Traumatic Stress Network is part of the Substance Abuse and Mental Health Services Authority nationally, focused on children and trauma and meeting their needs. And for a number of years, I was co-chair of this important committee. We had to give it up after the oil spill when I've been involved with that. But several days ago, they asked me, would I assume the co-chairmanship again? And of course, I said yes. It affects policy, programs, services for children and families around the country, including immigrant children, including those who are getting reactions, even though they're not in communities that have directly.
Well, let's talk about children and the effects on them when they see things on TV. Or at what age should a parent have a conversation with a child about what's happening in the world around them?
I think actually very early on. The first thing I would say is if children are going to be watching these events on TV and they're going to be hearing about them, it's important for a parent to sit down and listen to the children and find out what they're thinking and help them understand that these are isolated incidents and that everything is being done by the parents to make sure that they're secure.
So if they hear, even if they don't watch it directly, but if they hear something at school, their friends are talking about it, or they hear somebody else talking about it, address it head on?
Absolutely. And of course to recognize that people, including people in other communities, can have symptoms. They're usually short in duration, but children can become young children, a little more clingy, whiny, depend on their parents more. Even older children may want more security from their parents. And adolescents, we have to remember that it's a time when young people can engage in risky behaviors, and we certainly want to prevent that.
And to keep an eye on your children's activities as they get older, too.
And also, it would be better for them not to be watching hour after hour, and for adults too, not hour after hour directly of TV, but at least having some time off before they go to bed and some time to process it.
Yeah, good to turn it off sometimes.
Absolutely.
Thank you very much, Dr. Howard Osofsky. We appreciate the insight.